Over 60? What if the life-altering diagnosis of high blood pressure, the reading that pushed you onto a lifetime of powerful, risky medication, was based on a lie? This is the silent medical scandal affecting millions of seniors, a scandal born not in a lab, but in a simple, common error made right in your own home. Every year, millions of people over 60 are diligently checking their blood pressure, thinking they are monitoring their health, yet a staggering 75% of them are doing it wrong. This simple daily mistake is artificially spiking their blood pressure by 10, 20, sometimes even 40 points, and the result is devastating. Unnecessary diagnosis, unnecessary drugs, and unnecessary risk. Number 1. The white coat trap, the crisis. New explosive research from the American Heart Association confirms that these easily correctable errors create what doctors call self-induced hypertension. Imagine this scenario. Your heart is fundamentally healthy, your arteries are clear, and your true blood pressure is a safe 125/80. But because of a single procedural mistake, like crossing your legs or failing to rest, the monitor flashes a terrifying 155/95. That number is immediately flagged as stage 2 hypertension, justifying a powerful and potentially dangerous medication like a calcium channel blocker or an ACE inhibitor. The truth is, many seniors who are on these lifelong medications linked to chronic fatigue, kidney strain, and a terrifying increase in fall risk, may never have needed them in the first place. You are unknowingly self-sabotaging your own readings and essentially forcing your physician to follow protocol and prescribe drugs based on false data. The financial cost alone is staggering, but the cost to your longevity and independence is incalculable. In this deep dive masterclass, we are going to expose the 5 biggest mistakes you are making when checking your blood pressure, including the number 1 secret involving your blood pressure cuff itself, an error so common it impacts nearly half of all seniors. Stick with us, because the terrifying case story of Clara, who suffered a severe medication complication due to one simple mistake, will convince you to change your routine today. This information is the difference between a life dependent on pharmaceuticals and a life of vibrant, natural health. Before we dive in, tell us in the comments now. How many minutes do you rest before taking your blood pressure? We're reading and replying to every single comment with personalized insights. Now, let's begin by exposing the first mistake that is inflating your numbers. Number 2. Mistake number 5. The talking tax and the mental clutter. We start with mistake number 5, the talking tax and mental clutter. This is the easiest error to commit and the most common cause of unnecessary elevation. When you sit down to measure your blood pressure, your body needs to achieve a state of hemodynamic rest. When you talk, whether answering a simple question, whispering, or even listening intently, you are engaging the muscles in your throat, face, and chest. And more importantly, you are stimulating the sympathetic nervous system. This engagement triggers an immediate, albeit small, surge of norepinephrine, a stress hormone, which causes instant and rapid constriction of your peripheral blood vessels. Research published in the Journal of Clinical Measurement highlights this effect. Talking during a reading can elevate the systolic pressure, the top number, by a consistent 10 to 15 millimeters of mercury. Think about that. If your reading is 135/85 while talking, your true resting pressure is likely a safe 120/80. Yet, the machine recorded the number that puts you in the pre-hypertension category just one step away from a prescription. The solution: the 5-minute silent sanctuary. You must adhere to the American College of Cardiology's strict protocol. Sit in absolute silence for a minimum of 5 full minutes before initiating the measurement. No reading the news, no texting, no watching television, and absolutely no talking. you must achieve a true state of basal rest. Furthermore, if you are anxious about the reading itself, known as white coat syndrome, even at home, performing a simple 30-second 4-7-8 breathing exercise during that 5 minutes can calm your vagus nerve and prevent the psychological anxiety from falsely inflating the result. Do not confuse mental relaxation with physical relaxation. Both are absolutely critical. If you fail to wait those crucial 5 minutes, you are simply recording a number that reflects stress, not your actual cardiovascular health. Number 3. Mistake. No. 4. The crossed leg culprit and postural sabotage. Mistake number 4 is the crossed leg culprit and the dangling feet disaster. This is a profound error of posture that directly affects the mechanics of your cardiovascular system. When you cross your legs, even lightly at the ankles, you are creating an acute obstruction of venous return, meaning you are compressing the large veins in your thighs and pelvis. Your heart, recognizing that blood is not returning efficiently, must dramatically increase its output force and arterial pressure to push blood through the bottleneck and back up to the chest. This is a forced increase in blood pressure. A definitive meta-analysis from the European Society of Hypertension showed that sitting with legs crossed elevates the systolic pressure by an average of 6 to 8 mmHg and can increase diastolic pressure by up to 5 mmHg. This may not sound like much, but when you are hovering around the critical 130/80 threshold, 8 points of false elevation is the difference between health and chronic diagnosis. The error is compounded if your feet are left dangling off the edge of a chair or bed. When your feet are not supported flat on the ground, the stabilizing muscles in your lower back and core are engaged to maintain balance. This constant low-level muscle tension triggers a systemic stress response, contributing further to the false high reading. The solution, the perfect posture. You must sit in a sturdy chair with your back fully supported. Backrest is mandatory. Both feet must be flat on the floor or supported by a small footstool with your knees level with your hips. Your body should be relaxed, supported, and completely neutral. This perfect supported posture eliminates external stress on the circulatory system, allowing the machine to measure the true resting pressure of your heart. Ignoring this is inviting a diagnosis you don't deserve. Number 4. Mistake. No. 3. The cold cuff shock and the bare arm blunder. Mistake. Number 3 involves 2 physical errors that trigger an instantaneous sympathetic shock: the cold cuff shock and the bare arm blunder. First, the cold cuff shock. If you pull a cold blood pressure cuff out of a storage drawer and immediately wrap it around a bare arm, the sudden, localized temperature difference causes a phenomenon known as peripheral vasoconstriction. The small arteries in the skin constrict instantly in response to the cold. This constriction increases resistance, forcing the heart to pump harder to overcome it. This cold shock alone can spike your reading by 5 to 10 points. The protocol is clear. The cuff should be at room temperature, and your arm should be warm and comfortable. Second, the thick clothing blunder. While a cold cuff is bad, measuring through thick clothing, like a sweater or a heavy shirt, is equally disastrous. The bulky fabric interferes with the pressure transmission from the cuff to the artery, leading to an artificially high reading. The cuff cannot compress the artery correctly through layers of fabric, resulting in a miscalculation of force. The solution: the warm, bare protocol. The cuff should be applied directly to the bare skin of the upper arm, or over a very thin single layer of fabric, like a t-shirt sleeve. If your skin is cold, simply rub your arms together for 30 seconds to warm the area before applying the cuff. Ensure the cuff is applied smoothly and directly above the crease of the elbow. Remember, any resistance or shock, whether from cold, clothing, or muscle tension, translates directly into a falsely elevated blood pressure number. Number 5. Mistake. Number 2. The arm position lie, above the heart disaster. Mistake. Number 2 is a fundamental error of physics that almost guarantees a false reading. The arm position lie, measuring above or below the heart level. This is a purely mechanical mistake, but it is one of the biggest causes of measurement variability. Your blood pressure is standardized to the level of your heart, the right atrium. If you measure your arm position incorrectly, gravity immediately interferes with the reading. Measuring below the heart. If your arm is resting in your lap or hanging down, gravity adds hydrostatic pressure to the reading, leading to a falsely high number. This can add 5 mm for every inch below heart level. Measuring above the heart. If you hold your arm up in the air or rest it too high on a tall table, gravity removes hydrostatic pressure, leading to a falsely low reading, which gives you a dangerous sense of false security. The solution. The heart level mandate. Your arm must be resting comfortably on a table so that the cuff is exactly level with your heart. The middle of the cuff should align precisely with the level of your sternum, the breastbone. If your table is too low, use a cushion or books to prop up your arm. This ensures that the reading reflects the actual pressure generated by the heart, not an error caused by gravity. Failing to adhere to this simple physics principle is invalidating every number you record. Number 6. Mistake. Number 1. The cuff size trap and equipment failure. We have reached mistake number 1, the single most dangerous and most frequently committed error that is literally forcing doctors to prescribe medication: the wrong cuff size trap. This is the secret your machine is hiding, an error so pervasive it invalidates nearly half of all at-home readings. Your blood pressure cuff is not a one-size-fits-all device. If your cuff is even slightly too small, it acts like an overly tight tourniquet. It must squeeze the artery with disproportionate force to occlude it, leading to a massive overestimation of your actual blood pressure. A cuff that is just 2 to 3 centimeters too narrow can artificially add 20 to 30 points to your systolic reading. If your true pressure is a safe 130, the machine screams 160. Conversely, a cuff that is too large can give a falsely low reading, making you dangerously complacent. The solution: measure your arm. You must measure your arm's circumference in centimeters, halfway between the shoulder and the elbow. Then, check the label on your cuff. Most standard cuffs are for arms between 20 to 32 centimeters. If your arm is larger, common in men or those carrying extra weight, you absolutely must purchase a large adult cuff, 32-42 cm. Using the wrong size is not just a mistake. It is an act of self-diagnosis based on false data. Number 7. The medication trap. Unnecessary risks. Why is avoiding these false readings so critical? Because they lead to the medication trap. Doctors are ethically bound to treat the numbers you provide. If you bring in readings of a 150/90, they will prescribe one or more powerful antihypertensive drugs. Let's review the unnecessary risks you face when you take medication for a pressure that isn't really high. 1. Increased fall risk, calcium channel blockers and diuretics. These drugs can cause orthostatic hypotension, a sudden drop in BP when you stand up. This leads to dizziness, lightheadedness, and an extremely high risk of falls, which are the number one cause of injury and loss of independence after 65. 2. Kidney strain, ACE inhibitors. While often protective, these drugs alter kidney filtration. If your pressure was never truly high, you are unnecessarily putting stress on your renal system. 3. Chronic fatigue and depression. Many BP meds, especially beta blockers, cause profound fatigue and lethargy, stealing your energy for exercise and social life, leading to a rapid decline in quality of life. The truth is, your goal should be to treat true hypertension, not self-induced hypertension. By correcting the 5 simple mistakes we've outlined, you may find your readings plummet back into the safe zone, allowing you to discuss a reduction in medication with your doctor. Number 8. The 7-Day BP Normalization Protocol. Case Study Integration. Now that you know the mistakes, here is the 7-Day BP Normalization Protocol you must follow before your next doctor's visit. This protocol is designed to eliminate every variable and ensure you present your doctor with the most accurate, lowest possible reading. Case Study. Robert's Turnaround. Remember Robert, the 71-year-old on excessive medication? His journey wasn't just fixing his cuff size. It was about adopting this protocol. He was on track for doubling his pills, but by following these steps, he safely stabilized his BP. 1. The Hydration Rule. Days 1 to 7. Drink 1 full glass of water 30 minutes before your reading. Dehydration causes volume contraction and can elevate BP. 2. The Magnesium Supplementation. Start a high-quality magnesium glycinate supplement. Magnesium is a natural vasodilator. It relaxes blood vessels, which can naturally drop your pressure by a few points. 3. The L-hand check. When sitting for your reading, always use your left arm. Studies show that the left arm often provides a slightly lower, more accurate reading due to its proximity to the heart and the specific anatomy of the arteries. 4. The 5-minute silent reset. This is non-negotiable. Use the full 5 minutes to perform deep, diaphragmatic breathing. 5. The double check policy. Take your BP 3 times, 1 minute apart. Discard the first reading, it's often the highest due to anxiety, and average the second and third readings. This average number is your most accurate representation. By following this precise protocol, you are providing your doctor with data that reflects your true cardiovascular health, not your anxiety or a mechanical error. Number 9. Final warning. Your journey to optimal health starts with one simple choice: accurate data. Do not let simple, avoidable mistakes force you onto a lifelong path of medication and risk. You are not just a number on a machine. You are a complex, resilient body that deserves an honest assessment. The time for blind measurement is over. Get off the floor, uncross your legs, empty your bladder, check your cuff size. If this video has armed you with the truth to take back control of your health, please like this video now to help us reach more seniors who are trapped by false readings. Subscribe to the Senior Community channel and join our mission to live stronger, longer, and medication-free. Now go take your blood pressure the right way. Your health depends on it. Thanks for watching.